Hi, I'm with Professor Robert Graham, cardiologist from the Victor Chang Cardiac Research Institute. I'm Professor Jason Kovacic, Director of the Victor Chang Institute. We want to talk to you today about COVID-19, some of the issues that are arising from that. Bob, let me lead off by asking you, we've seen a lot of changes in the way patients are coming to the department, coming to the emergency room. What's been your perception on what's happening? Are we seeing less people coming to the ER because they're staying at home and scared?
Well, certainly that's happening in other countries in a big way. Up to 40% of people in the United States are not coming into doctors when they should be coming in. They're leaving their illness until it's very advanced, and they're obviously getting into trouble. Heart disease often is a chronic condition that needs to be looked at by your doctor on a regular basis. And if you don't have that done, then your medication's not monitored and you can get into problems. So I would urge people to continue to spot this time, to at least contact their doctor and make sure that they at least have a telehealth consult. And I'll let you explain to people what that is, but it's very important that patients keep up their visits to their doctor and continue to get their treatments adjusted appropriately.
Right, it's a great point. So I've just come back from New York City where I actually still see some patients. Telehealth is really exploded in the COVID-19 era, and what it is basically us Skyping or Zooming or doing some other sort of video meeting and conference with a patient in the place of what would normally be a clinic consult visit. So a lot of the information can still be gathered by your doctor through a teleconference. Obviously, one of the limitations is there isn't a physical examination, but even without that, most of the consult can still be effectively done by telehealth by connecting out with your doctor. So certainly it is a safer way of doing things if there is a lot of virus and a lot of infection going around, and it keeps both your doctor and you protected from any possible transmissions, keeps you off public transport and so on. So Bob, back to these patients and who needs to be careful. Specifically, which patients with different diseases need to be careful in this COVID-19 era? Who's at risk?
Yeah, look, the people who are at risk are those obviously who are immunosuppressed because they've had a heart transplant or any organ transplant, people with underlying heart disease where their heart function is not normal, that is, it's less than 100%, people who've got diabetes, people who are overweight. Obesity seems to be a recently identified risk factor that if you get COVID, you're going to do worse. Yeah? Now, one of the other things I'd bat back to you, Jason, is a lot of people are worried about coming in and having tests done if they're coming to a hospital. What is your response to that?
Right, especially now that the rates of COVID, the number of infected people with COVID in Australia are so low, people really don't need to be concerned about coming into the hospital. In fact, we'd encourage people to come in because people have really been away from their healthcare providers for a good number of weeks now. The hospital systems are very well set up to triage people and point them in the right direction as to whether they've got COVID or whether they're coming in for their routine tests. So really the risk of getting an infection of COVID, if you're coming into hospital to have a test, is extremely low, and people really need to be taking care of their other long-standing issues at this time. So Bob, let me ask you, one of the things coming through COVID is the possibility of treatments and therapies. And one of those aspects is a vaccine. Where do you think we stand with a vaccine?
Look, I think I hate to be a pessimist because one hopes that the vaccine is the way forward, and it is the way forward if we can get a good one. But I think all the indications at the moment are that's going to be very difficult and it's going to take a long time. At least I would say at best 12 to 18 months, and I think that's optimistic. We don't have a vaccine for any of the coronavirus family yet that's effective, so it's going to be a challenge. In terms of other treatments, yes, lots of other treatments are being looked for. You've probably heard of one, and I'll let you comment on one of them, which can potentially cause heart problems, so it has to be used carefully, is hydroxychloroquine, which is an anti-malarial drug. You've probably heard about experiences with that.
Yes.
People do need to be careful.
Yes, so we at the Victor Chang are involved in a couple of initiatives against COVID, and one of those is looking at this drug, hydroxychloroquine. It is a form of immune suppression drug. It's used in people with lupus and sarcoidosis and various other conditions. But it potentially, at least in certain experiments, has been shown to have some effect in suppressing the virus. But it really is unproven at this time. A lot of people are receiving it, but we at the Victor Chang are looking into seeing how it can affect the cardiac electrical system, because there definitely been reports of changes in the electrical pattern in the heart, which can lead to this situation known as long QT interval. So again, something important we're looking into with the Victor Chang at the moment.
I think that's a really important issue, Jason, because while the problems you get, heart problems, may not occur very frequently with the drug, you can imagine if you've got hundreds of thousands of people on it, then you're going to get hundreds of thousands of cases of side effects. So one does have to be very careful.
Great point.
Yeah.
Look, one of the other interesting things I wanted to raise that we're doing at the Victor Chang is through Bob, this mesenchymal stem cell therapy, or investigating the possibility that that may be helpful for patients with severe COVID-19 infections. Could you update us on that, Bob?
Yes, it turns out there's a type of stem cell which, first of all, is very useful because you don't need to have it matched, like you have to have an organ matched and you don't need any immunosuppression. You can give it from one patient to another. So we can take these stem cells from a healthy person and put it into someone who's got very severe respiratory disease due to COVID, and try and dampen down the hyperimmune system activation that these patients get. Now, these cells have a nice ability to try to be able to dampen down the immune system. And we've now been able to give them to 10 people on compassionate grounds in New York who've had very severe COVID disease and are on a ventilator for respiratory disease. And they seem to have done extremely well. But it's early days, it's an uncontrolled study, and we need to look at it very formally and carefully to make sure they're safe and they're useful.
I've heard one of the interesting positives to come out of this is that while this is something we're hoping to do here at the Victor Chang, we've actually got so few patients in the hospital system here that we may not be able to get it going. Is that reality?
Yes, that's reality. What a nice situation to be in.
Exactly. That's great. So look, one of the final key points I think we need to touch on is what symptoms do people need to be careful of? If you're breathless, do you need to come immediately to hospital, or how do you work through that as a patient?
Yeah, look, I think if you're a heart disease patient, you know you've got an underlying heart disease and you start to get breathless, you certainly should consult your cardiologist, because that's not a symptom you should have normally, especially if it's got worse or you've had it for the first time. The other things that would make you think you've got heart disease as opposed to COVID is if you get breathlessness in the absence of a temperature, in the absence of a cough, in the absence of muscle aches, which are all the symptoms you get with COVID, then, or in the presence of chest pain, which might make you think you've got heart disease causing breathlessness, then you certainly should consult the doctor. And in either case, I think you shouldn't wait until things have got too far. It's easier to treat people when the disease is not that severe.
Great. Look, those were the main questions I wanted to address. Anything else from you, Bob?
No, look, I just encourage patients not to be scared or worried about coming in. Chances of getting COVID are very, very small. We take extreme precautions, and we're in this wonderful situation in Australia. We're better off than virtually any country in the world in the fewest number of cases worldwide, and hopefully that continues.
Great. Well, we'll end it there. I'd encourage you, we've got several videos up on our website at the moment. Please check them out. There's a lot of information there. There's also a Q&A we've got on our website about COVID-19. Please take a look. A lot of information there for you. Thanks for watching the video, and we look forward to getting back to you again soon with more updates.